Good morning, all of you. This is Dr.Shaik Afsar Pasha, Neurologist or Neurophysician, on behalf of our hospital, ANGC. Here, I am here today to talk about the introduction of our hospital and creation of our new YouTube channel called ANGC Vijayawada. The hospital, the ANGC, the expansion of it is Ashraf Neuro ICU and Gynae Care. This hospital is located in Vijayawada Bantam, Krishna district, Andhra Pradesh, South India. This hospital was established in 2013. So over the last 8 years, this hospital was providing the services. This hospital has 5 departments, namely Department of Neurology, Department of ICU and Critical Care, and Department of Gynae Care, Department of Pathology, and Department of Physiotherapy. Myself being the neurologist handling the Department of Neurology, so I did my neurology training, DNB Neurology and DM Neurology from NIMHANS, which is a esteemed university from Bangalore. So being the neurologist, I deal with the problems related to the neurological diseases ranging from general headache, migrainous headache, or patients suffering from vertigo. That is, the patient comes and says that they have giddiness, and patients suffering from back pain, pain from the back, upper back, or pain from the low back, or weakness of either one hand or 2 hands or 2 legs due to any other cause, like ranging from stroke to trauma to any other cause, and patients with weakness of mouth, like facial deviation, that's called facial palsy, either due to a general cause or a systemic cause, and patients with memory problems like Alzheimer dementia or dementia of any other cause, and patients having brain fevers, especially the meningitis and encephalitis, what we call, especially as we passing through the COVID-19 tough pandemic crisis. Even in these times, we were seeing the patients with brain fevers and advising the treatments, and patients who are suffering from the numbness of hands and feet secondary to the peripheral nerve problems, or because of the myelopathy, card involvement. That's what we call, because of the higher nerve dysfunction. Under the neurology, we have a laboratory services, namely called EEG, electroencephalogram, and nerve conduction studies to study the nerves of the human body. Under the Department of Critical Care, we have a renowned doctor called Dr.SHAIK ARIF Pasha. He did his critical care training from a famous institute of South India called Nizam's Institute of Medical Sciences. He is a very compassionate, a caring, a well-educated, well-mannered doctor. So Dr.SHAIK ARIF Pasha is very much well-trained in handling the critically ill patients. And the problems of the patients might be ranging from various dangerous fevers like COVID-19 illnesses and severe problems like multi-organ dysfunction syndrome, where the patients present with hypertension, hypothermia, and severe problems, and patients present with shock either due to volume loss, that's called hypovolemic shock, or because of the infection called septic shock, and patients present with low sodium because that's coma secondary to the low sodium, that's called hyponatremic comas, or comas due to alcoholism, coma due to either low sugar called hypoglycemic coma, or coma due to high glucose called diabetic coma, hyperglycemic comas. We have very well developed ICU with ventilators and monitors, and we have BiPAP and CPAP as well. Under the Department of Gynecology and Obstetrics, we have Dr. ROOHY Begum. She did her training from a famous institute, the Government General Hospital, Guntur. She is very well trained in handling the normal deliveries and as well as cesarean sections. She do see patients with problems of infertility and problems related to pregnancy and the ladies' monthly health problems. And she is also very much well trained in birth control operations like family planning. And she has unique skill of doing hysterectomy, vaginal hysterectomy. That's what we call is like removing the uterus, that is through a normal aperture rather than opening the abdomen. She has a unique capability of removing the uterus through a normal route. Under the Department of Pathology, we have Dr. Rizwana, who did her training in pathology from NR Medical College, Guntur. She is excellent. She has got experience in the field of pathology, and she was the one who made the availability of the kits and the tests related to antigen tests and antibody tests for assessing the severe and the dangerous COVID-19 illnesses. She made the availability of D-dimer and LDH and seroferritin levels for assessing the severity of the illness. Under the Department of Physiotherapy, we have Dr. Sabiha and Dr. Amruta, who are working hard to relieve the sufferings of the patients with morbidity, like patients with radiculopathies, back pain, neck pain, and patients with facial palsies, and patients with weakness of the hands, like weakness of the legs or hands or face, or even patients present with frozen shoulders. The other facilities what we have in our hospital are the digital X-rays, electrocardiogram, ECG machine, and we have evoked potentials. We have machine for evoked potential, and we do have ultrasonic machine, and 2D echo, and Doppler machine also we have. So this is an introduction of our hospital services. So I request all of you to bless us and to support us, and for increasing the awareness of the illnesses. And if you are seeing this video, please like if you like it, share, make a comment, and please subscribe it and hit the bell so that in near future you may get better videos with a good evidence-based medicine, so that you can take practical aspects to prevent and to treat. Thank you one and all.